Hi, Dr. Scott Glidden here to answer this question that gets asked all the time. People go on Google, Facebook, Instagram, ask their friends and family what the magic fix is for their problem. Do I need an inversion table? Do I need a Theragun? Do I need to see a chiropractor? Oh, I've got this acupuncturist, this physical therapist is great. This person does energy work. Try dry needling. There are so many things people try to fix their problems. And the reality is, not many of them are going to move the needle on how you feel. And you might ask, but why? All these people have these certifications, they got these letters after their names. This product seems so cool and the advertising is so slick and everybody seems so happy when they use a little massaging gun on Instagram. Why won't that work for me? Answer is very simple. If you want your problem to be fixed, you need to have a solution that offers durable, measurable results. So, your little punchy gun thing on Instagram will feel really good, almost a painful good, perhaps at first, and then you're like 20 minutes later, like, oh, this feels great. And then an hour later, you're back to feeling like crap again. And why? If you have to rely on a chiropractor, a weird gun thing, some modality to stay in tip-top shape, if you have to do it multiple times a week or every time you do an activity, you're just putting a Band-Aid on the problem. The magic in the magic fix is finding someone who recognizes you have a complex problem that needs an accurate diagnosis. Because all these other approaches are just trying something to see if it sticks. They don't know if it's appropriate for your problem, if they're going to do worse, they're going to move the needle at all. They're just doing, hey, I have a hammer, I'm going to make your problem a nail. When in reality, you could need a screwdriver. You need someone who can recognize that the proper diagnosis is going to be the one person who is going to send you in the right direction. Because recognizing what the problem is the first thing, an accurate diagnosis. And from there, then you can actually consider what treatment's going to be. But until then, there's no such thing as a magic fix. You can spend all the money in the world and all the bullshit on Instagram, and you're not going to find the results you want. Thanks.